My name's Dr. Feisul Idzwan Mustapha. I'm a consultant public health medicine specialist working in Malaysia, and I am also the director for the Perak State Health Department in Malaysia. If you look from the global perspective, it will be very specific to the healthcare system in the country. So I would say the first main challenge is that the context matters. How financing is, the healthcare system is being financed, and what's the priority of the government of the day. Because while we're talking about cancer today, there are many other health issues that governments face around the world. So that would be first. The second, specific to introducing innovation, is that it has to fit the current system. You cannot treat it in isolation, especially for cancer innovation, because cancer is just one non-communicable diseases, and non-communicable diseases, or NCDs, is a big issue for many countries, and you need innovation in all of the NCDs and not just in cancer. So acknowledging that you are introducing innovation in a very busy space will be another challenge. Firstly, people don't like change, even when the change is good for them. So you would need champions. It is important, and that will be the first recommendation. We need champions in this space. Secondly, for me, which is very important, the champions must acknowledge that innovations must fit into the system. We often like to think that innovations will change the system, so that the system changes around the innovation. But however, for me, the biggest challenge is how do you fit innovation into specific contexts with the different countries and with the different healthcare system. So your champions must acknowledge this and must work with the respective stakeholders. I use the word stakeholders, which is easier, in how you not just innovate, but how you engage with the innovation the best that you can with the resources that you have. Patient-centric, perhaps people-centric, more personalized. Well, this is more talking about patient care. I'm talking about systems approach. So this is how you acknowledge that there are different systems. And when we talk about systems, I talked about NCDs just now, right?
Yeah.
But healthcare system by itself do not operate in isolation. In a country, you have your healthcare system, but it also is interlinked with the economic system, with the education system, with the social welfare system. And sometimes it's very easy when you're championing a cause to very focus. You need focus, but at the same time, you need to have the bigger picture. And for me, the bigger picture, where I am looking at the social and also the commercial determinants of health, you need to have a broader picture, and your solutions, when you pitch it, for example, must take into account, and you have to acknowledge, I'm not saying you can solve all the problems of the country, but you need to ensure that you are able to convince the people making the decisions that this is part of the solution. And while you need other parts of the healthcare system and other parts of systems within countries to change if you want to have the best outcome from your innovation.